Hello and welcome to week 52 of Bariatric Bloke. Couple of days late, and there's a couple of good reasons for that. This was 1 year since I had the operation, which was SADI-S at Wentworth Douglas with Dr. Dima Habaleshko. Let's see, the reason why I waited a couple of days was because on Friday I had my 1 year follow-up with the nurse at Wentworth Douglas. So they take your weight and they've checked your blood and all that sort of stuff. And overall, pretty good. Zinc a little low and folic acid a little low. So we're just adjusting the vitamins a little bit on that. But for interesting stats, total weight loss since 1 year ago is 67% of my excess weight has gone. So I still have excess weight, which is, not a surprise. And I think finally my stall has come to an end. This morning I was at 249, so that brings the total to 155 pounds, I think, in a year and 2 days. It's pretty good. So somebody had said they hadn't seen a full body shot in a while, and I was kind of holding off a little bit, and also I grew the beard back to try and be as close to the original video as possible. But this is the same shirt I wore in the original video. The shorts I think are a little different. I'm not sure where the shorts I wore in that video are. They've probably been thrown in the trash if I was smart. But I'm going to take a couple of steps back and we'll give you the full comparison. And what I'll do is I'll edit into this video the the second day, the day after the surgery or whatever. So I am actually, I've got a few bulldog clips around the back of my shirt here, but here we go. There's one bulldog clip, and here's another bulldog clip, and my shorts are probably going to fall down, but this was the shirt I was wearing, and you can see, oh, and there goes the shorts. This shirt was not exactly super baggy before, but you can see there's quite a lot of space in it now. So actually we'll just take this shirt off, it'll be easier, and then I'll pull the shorts back up. Okay, and then get the shorts back. And also on this, I've had to move the belt all the way to the back to actually have any hope of holding it up for a second, but I'll put the belt back where it was that week. So these are my shorts that I wore actually the day off surgery, and these are the ones I've been on before and got in twice. But I could probably make a couple of the shorts that I'm wearing right now in there. So yeah, they're not going to be used again. Maybe a sleeping bag for a small child. So let's see. So yeah, and then my stomach, I still kind of wear my belt higher. I could get away with smaller shorts if I was to do what I did before and put my belt down below. But a lot of people ask about the excess skin and stuff like that. Insurance will cover an operation if I need it, but you don't get that done until at least 18 months after surgery. At the moment, I've still got too much fat in places to figure out where excess skin and stuff's going to be. But I can give you what my stomach now looks like. So if you go back to the original video, you can kind of see, and then I can kind of pull it down, and you can see that that's where the excess skin's going to be. But I think it's a bit like, I've got a jacket that I wore that first week, which was tight the first week, and now it's kind of like all sloppy and stuff at the front. But I can't even see where the scars and stuff were. But yeah, it's quite a big difference if you go compare day one to day whatever it is now. Physical dimensions, I'm down to a 40-inch waist, which I think the last time I had that was in secondary school, probably when I was about 17, 18. And then let's see. So questions though. So one of them was about the I have to try and say this right. Peniectomy or something, the one where they remove skin. What are my thoughts on that? So, to be honest, I'm not too concerned about that. One, I know that actually the recovery from that operation is much more severe than the recovery from the gastric bypass surgery. So I'm in no rush to go get that done. Somebody asked if I liked the results, and I misunderstood their question, but yeah, I mean, you know, I have no regrets. The benefits, I think, speak for themselves, just from things like, you know, no more type 2 diabetes. I think when they decide to operate on my heart, it's going to be much easier now than it was before. And I mean, I can tell you, when I go have my echocardiogram, they no longer have to inject dye into me, which they used to have to do. But what I did was I came up with like a Dave Letterman style top 10, and I'll cut to that in a second and give you my top 10 things about having bariatric surgery. And then let's see, what were the other questions? I don't remember. But I'll actually I'll do the top 10 as a separate video and post it after this one. Yeah, so I'm not going to do the weekly videos anymore, but I will probably just check in every now and again. But thank you very much for those 7 or 8 of you that watched every week. It was kind of nice knowing you were there, and hopefully you found it interesting, and hopefully this may be useful for somebody else that's thinking about doing it. But thank you very much, and we'll see you soon.